boosters, we see the coverage is at about 3.2%, which translates to about 43.4 million people having had their booster doses across the continent. The number of countries who have crossed the 70% mark for the eligible population still remains the same 13 countries, and that is Tanzania, Seychelles, Mauritius, Botswana, Rwanda, Comoros, Liberia, Uganda, Cape Verde, Morocco, Zambia, Somalia, and Mozambique. We are still working with our member states so that we can see the vast majority of them crossing this important coverage for the eligible population. When we look at the impact that this expanded vaccination is having on the continent, we see that many more people are actually willing to take up the COVID-19 vaccine, including booster doses, so long as it's made available to them in an efficient and accessible way. We've seen the numbers increase when we have mass vaccination campaigns, when we have targeted campaigns, for example, for the youth or for health workers or for students in schools. We've also seen that for countries that have actively pursued vaccination for populations below the ages of 18 and above the ages of 12, we see that there has been some significant increase in the vaccination coverage. So we're really encouraging our member states to have specific programs for young people. The Bingo initiative is already in place so that those who are 12 to 18 can easily be able to access COVID-19 vaccination. Specifically for our Saving Lives and Livelihoods program, over the last 1 week, the final week of 2022, 399,000 doses of vaccines were facilitated through the SLL program. But cumulatively from the beginning of this campaign, we have facilitated through the SLL program 10.6 million doses across the continent, which is a very big progress for us, looking at where we were just about 6 or so months ago. Our key messages continue with our member states continue to be that although the holiday season usually would impact on vaccination activities, we continue to encourage our member states to integrate COVID-19 vaccination into their expanded programs of immunization campaigns. We continue to encourage supplies of all types of vaccines so that the young people as well have access to COVID-19 vaccination. So that is about COVID-19. And the third public health event that I would like to share today is on Mpox outbreak across the continent. Since the last briefing, we've seen 106 new confirmed cases and 6 new confirmed deaths as a result of Mpox. And this has been reported from 5 countries across the continent. These numbers are a representation of a 136% increase in the number of new confirmed cases and a 30% increase in the number of new deaths. This confirms to us that Mpox is still a significant public health event on the continent that we need to be giving full attention so that we can be able to reduce the effects that it has here in Africa. From the beginning of this recent outbreak in the beginning of 2022, we have seen 1,262 confirmed cases, 226 confirmed deaths from 13 of our member states here in Africa. It is a situation that translates to us losing 1 in every 5 confirmed cases in Africa. And 3 member states, the DRC, Ghana, and Nigeria, are accounting for 94% of all these confirmed cases during this current outbreak. We, as Africa CDC, continue to support our member states, particularly the laboratory test kits, so that we can be confirming cases. And therefore, our data will be more precise. We continue to train the health workers, those who are in the front line and those who are working in the laboratories, those who are engaging with the communities across all the high-risk populations, particularly in the countries that are most affected. And for the vaccines, we are going, God willing, to start active distribution in this first quarter of 2023 as our discussions with our partners are finalized after the holiday break. The fourth public health event I would like to share is the multi-country cholera outbreak. We are seeing a situation across the continent where some countries are currently experiencing an upsurge in the rate of new cholera cases, particularly in the Southern Africa region, and more so in Malawi, which I would like to give a little bit of a detail today. But cumulatively, when we look at the situation during this current outbreak of cholera across the continent, we see that since the last briefing that we had, we have documented 13,876 new cases. And this includes 393 new deaths as a result of cholera across many different countries here on the continent of Africa. Those countries that are most affected are Burundi, the DRC, Kenya, Malawi, Nigeria, and Somalia. And as I said today, we'll focus a little bit on Malawi during this briefing. Cumulatively, from the beginning of this current outbreak of cholera, we have documented 93,034 cases, and we have also seen 1,949 deaths across 14 of the member states here in Africa. This means that we are losing 1 in every 10 persons who are reporting with cholera. And this is a very high number for a disease that we can be able to effectively bring under control. Looking at Malawi, on the 5th of December, the president of Malawi, President Chakwera, declared cholera a national public health emergency and put in place the necessary local systems. And as partners, including us as Africa CDC, we are providing full support to Malawi to bring this devastating outbreak under control. You will recall that the genesis of this particular outbreak was Tropical Storm Anna and Cyclone Gombe last year, which caused flooding and displacement of many people in several Southern Africa countries, including Malawi. And therefore, access to safe water, sanitation, and hygiene became a very big challenge. To date in Malawi, we have documented 18,222 confirmed cases, 620 deaths from 29 districts. And indeed, since the last briefing, we have documented 4,575 new confirmed cases and 216 new deaths. These are significant increases, and they represent over 300% increases in the number of new cases and deaths, and means that we need to act very swiftly to support Malawi to bring this particular cholera outbreak under control, particularly because it is affecting the most active age group, which is between 21 and 30 years across both genders in that particular country. So although 14 of our countries have been affected by cholera outbreaks during this current outbreak season, Malawi is in a special situation, and we continue to support them, including all the others, particularly those who have acute outbreaks like Burundi, the DRC, Kenya, and Nigeria. We continue to support all the countries with a special focus on Malawi, where we are providing training to the environmental officers. We are providing infrastructure to be able to support clean water provision. We are ensuring that our technical teams are working with the Malawian government in providing good coordination on the ground for all who are working in this space with the Malawian government. The fifth public health event I'd like to share today is Lassa fever. Since the last briefing, we have documented 164 new cases and 1 new death from Lassa fever. This is a 41% increase in the number of new cases and a 50% decrease in the number of new deaths. Cumulatively, we have seen 9,500 cases of Lassa fever and 223 deaths, which gives us a cumulative case fatality rate of 2.7%, with mostly Guinea, Liberia, Mali, Nigeria, Sierra Leone, South Africa, and Togo being affected. And at the moment, it is largely seen in Nigeria. We are therefore working with different partners to support the most affected countries in ensuring that they have the test kits they need, they have the training that is required to be able to support community engagement and management of the cases that have been diagnosed, and of course putting in place an early warning system so that it does not spread to other parts of the community. So these are the 5 public health events that I wanted to share with you during this first briefing of our new year. And as we look into 2023, there are some key things that really we would like to cover during this new year. The first is to wrap up control of some key public health events, including the Sudan type Ebola virus outbreak in Uganda, the mpox across multiple countries, and of course, COVID-19 and cholera. We would really like to bring these outbreaks under control within this first part of 2023. Secondly is we are working towards the full autonomy of Africa CDC, and the upcoming AU summit is going to be making some key decisions that will help us to implement the new statute and therefore get Africa CDC into full autonomy. So this is a second thing that we're really looking forward to. And apart from that, also launching our new strategic plan to ensure that we have a clear guide on what we want to do for the coming year. Thirdly is strengthening early warning systems. We have multiple outbreaks, and the fact that we are bringing most of them under control without getting into the public eye, it tells you that our strategies are working, and we are strengthening the early warning systems, particularly at country level. The few that we get to know about, we want to make them very few, and we want them to last for a very short time. We are very proud of the work that has happened in Uganda, that in under 70 days, an outbreak has been brought under control and we started a countdown. We want that to be cut down even further so that any outbreak that becomes large and of a public health interest, we bring it under control in a very short time. So we want to strengthen our early warning systems, and we want to strengthen our response systems of the continent to be able to do that. Fourth is in implementing the new public health order. We want to ensure that apart from our staffing levels being adequate, apart from our institutions being fully resourced, apart from us building partnerships on the continent and beyond, we want to ensure we have local manufacturing happening actively for everything we need within the health security space. In this way, we can then be confident that any time that an outbreak comes, we have the local capacity to be able to manufacture what we need and deliver it efficiently. Finally, in 2023, is we want to engage with the youth. And in the coming few days, we will be releasing on the website the youth advisory team that we've been finalizing and picking. We want to ensure that the youth see Africa as their trust as well. We want to see the youth seeing Africa as not just home, but it is also a place that they need to be fully engaged in protecting and growing in as far as health security is concerned, but in the broader context of health. So we are going to be making that one of the key things that we do during 2023. So these are the things that I wanted to share today, Wayne, and happy to hear from anyone who may have some questions. Thank you very much, and back to you.
Thank you very much, Ahmed, for that briefing. We now move into our question and answer section, and let me start with some questions that have come through on our WhatsApp platform. And these three are coming from Sydney Kawadza, who is with the Independent in Zimbabwe. Sydney has three questions. The first one, how big is the threat of the upsurge in COVID-19 cases in China, considering that the Asian country is opening its borders and allowing its citizens to travel across the world? That's the first one. The second one is, should African countries follow the stance taken by some Western countries that are looking at imposing new COVID-19 restrictions on Chinese visitors? And then the third one, how has Zimbabwe fared compared to other African countries in terms of vaccinating its citizens against COVID-19?
No, thank you. Thank you. And I think I'll start with that last one. We publish the vaccination rates on our website. So it's you can be able to go in there and you see not just Zimbabwe, but all the others, what the performance of COVID vaccination is. It is on our website at africacdc.org. In as far as risk is concerned, anywhere that you find numbers of infections increasing is a risk to an increase everywhere because of the way we are interconnected today. This is something that we have been saying from the beginning of the pandemic, that we need to all be on the same space where we protect each other and make available all the tools that we need for that protection. So any upsurge of cases anywhere becomes a concern to the rest of the world because we are so easily interconnected. What to do about it, to the second question about restrictions, what to do about it is what we insist as Africa CDC must be based on evidence, and we must follow good science so that whatever action we take gives us good and desirable results. So travel restrictions have been shown consistently to not be very effective in a situation like now, where we find the virus has already really spread across the world. What is important is identifying those who are carrying the virus and ensure that they do not expose others to that particular virus. This is the surest way, and travel restrictions really does not give that desired result. Second thing that we need to do is to get vaccinated, because we are in that stage of the pandemic where we are testing and then we are treating. Vaccines are available, so let's take them. It makes us avoid becoming sick, and it reduces the rates of infection from one person to the other. So get vaccinated, get boosted if you're eligible, test so that you can go to restrict the transmission from one person to the other, because if someone knows they have the virus, then we know what kind of behavior that they should be able to have. But travel restrictions have been shown time and time again not to work. And finally, for us, we're asking our member states, let us do genomic surveillance. Let us be awake to the fact that as the virus gets more transmitted, then the risk of getting a variant that will be different from what we already have now also increases. And we want to be sure that we are ready in case anything like that happens, and that can only happen if we do genomics surveillance. So we are all safe when all of us are safe, but we are all not safe if at all there are cases rising in any part of the world, and science has guided us very well on what we need to do. Travel restrictions will not be a useful action at this stage of the pandemic.
Thank you, Ahmed. Let's say hello to Coletta Wanjohi. Coletta, hello, please go ahead with your question. Hello, Coletta.
Yes, Madam Wan, can you hear me?
Yes, we can hear you. Please go ahead.
Thank you. Happy New Year. Happy New Year to you too, Madam, and Happy New Year, Daktari. Maybe Daktari, if you could kindly just shed light as we here on our status as far as vaccine manufacturing is concerned. Is there still the appetite, quote unquote, from member states on setting up vaccine plans, or are we seeing new partnerships on setting up plans not only for COVID, but also the idea was to have for other vaccines too. Then secondly, if you could also just go into details a bit about, as we set up 2023 and the summit will be meeting soon, what will be your call to the African member states, especially to ensure that the new public health order really becomes a success according to the Africa CDC strategy? Thank you.
Thank you, Coletta. And the appetite for setting up and expanding vaccines manufacturing facilities, and in fact, manufacturing for other health products on the continent, is growing. And we have many different facilities increasing their capacities, and we have a few that are being built also from scratch. So our role as Africa CDC in implementing the Partnership for African Vaccines Manufacturing continues. We are encouraging a coordinated approach where different types of vaccines are being manufactured by different countries and different facilities, so that we don't have a flooding of one type of vaccine. And at the same time, we are also encouraging countries to go into other products, diagnostics. We need to manufacture our own diagnostic kits, therapeutics, and countermeasures like masks and PPEs. We want those manufactured here on the continent. In fact, we are encouraging manufacturing of even the equipment that we need, whether it is oxygen concentrators, etc., here on the continent. So that appetite is still very much with us, and our countries have committed, and we see very good progress towards that expansion of capacity for manufacturing of different health products here on the continent of Africa. On the issue of what my call will be, we are going into a period of transition at many levels for this continent. Implementing the new public health order is the biggest transition, where Africa, and this is my call really to our member states, where Africa feels and is confident to handle its own health security, not alone, but be in charge of our own health security, making everything an African priority. Before we engage with the external partners, we engage on the continent and design our priorities, and we agree on the direction that we need to go. So this is really my call, that the new public health order is the biggest transition for this continent, being responsible for and charge of our destiny in as far as global health is concerned, in as far as health security is concerned, in as far as UHC is concerned. This is only us who can be able to do it, and we will be able to do it when we come together and agree on a good direction that we need to be following in implementation of this new public health order. I must add here that many partners have not only appreciated, but they have understood where we are coming from in as far as the new public health order is concerned, and they are willing to walk with us that journey of implementation of the new public health order. So we are quite excited, looking forward into 2023, creating real outcomes for all these efforts that we've been putting in place for quite a while now. Thank you.
Hello to Janice Q. You are joining us live on our platform. Please go ahead with your question, Janice.
Hi there, you can hear me fine?
Yes, we can hear you. Please go ahead. And Happy New Year to you.
Same to you both. My first question was just a sort of broad brushstroke question. I was wondering what Africa or Africa CDC's thoughts on why we are seeing such a resurgence of so many diseases across the continent. And then my next two questions were around Malawi and the cholera outbreak. With a case fatality rates of about 3.4%, I was wondering what your thoughts were on why so many patients are not getting treatments in time. And then the last question was, you know, at the moment, the outbreak, the cholera outbreak in Malawi is the worst in 20 years. Is Africa CDC concerned that it may still evolve into the worst ever?
No, thank you. Thank you, Janice. Let me start with that last question, whether this will be the worst. Frankly speaking, every outbreak is bad. Comparing them is fine for scientific purposes, but for us in the front line, any death that is the result of something that is preventable is bad. And for us, this particular outbreak in Malawi has lasted a bit too long. And we really need to put every effort to not only bring it under control, but put systems in place that it never becomes this big again. Outbreaks will occur, but we want to have systems in place that control them quickly so that we don't have these large and very expensive in terms of lives lost outbreaks into the future. In as far as the resurgence of diseases, particularly those that come as an outbreak is concerned, there are multiple factors. I will not say one is higher than the other one, because for each and every disease, in each and every outbreak, it's different. But there are some threads that we can be able to point out to. One is our capacity to identify an outbreak has increased. So much so that if something is happening in a village, in a country, somewhere in Africa, due to the nature of social media, we get to know about it very quickly. Before, it used to happen, controlled, with very little information getting out into the public. So this is something that we need to put in mind as we continue to engage with the different outbreaks that are coming on the continent, that we are identifying them quickly and the information is being shared much more easily today. Second is the patterns of life have also begun to change. We are seeing a lot more deforestation. We are seeing climate change situations that are adjusting the way in which we engage with the environment, both natural and the animal bird environment. We are also seeing a change in immunities across not just the continent, but also across the world. Diseases that we thought we had under control before, when we have gaps in immunity, then those particular pathogens then rise up in the community again. So as the transition happens of climate and into the population, the way in which we engage with each other and with our environment, then we get into contact with many more pathogens. Those pathogens that had been under control also get an opportunity to then start interacting with the communities again. So this means that there is no done deal. Even those pathogens and disease conditions that we had under control, we must continue to have a high index of a suspicion whenever a case comes, but we must also continue to have very high protection within the communities, and that means vaccination and doing the right things, and as far as public engagement is concerned, to be able to bring these under control. Finally, is the ease with which we travel within the continent, the ease with which we travel globally, means that we are allowing new types of pathogens to come into our communities, or new variants of the same pathogens are also coming into our communities. Now, these mix of different possibilities makes it easier for us to be able to identify that there has been a new sort of outbreak within the community. Specifically for Malawi, case fatality rate very high still, and we would like that to be brought lower using tools that we already have: vaccines, treatment, provision of a cleaner environment, clean water to the health facility, or presentation for management comes early, and therefore we are able to save many more lives. People are coming late for different reasons. The places are flooded, so access to health facilities movement becomes difficult. Communities have been cut off and isolated, so reaching them becomes difficult as well. There are cultural and religious practices at play. These also contribute to late presentation to the health facility. So all these are being brought together in our risk communication and community engagement. And we are seeing the results of the change within the communities, and therefore getting cases earlier, treating them earlier, and therefore saving many more lives as we fix the system issues that result in the cholera outbreaks in the first place. It is not unique to Malawi. This is something that happens if we do not take all these different issues into consideration before the outbreak comes.
Thank you, Ahmed. I don't see any questions that are coming in. So this is about as good a time as any to bring our session today to an end. But as usual, please give us your very key points that you would like the audiences to take away from this briefing today.
Thank you, Wayne. And I would like to share the three things for today. The first is on Ebola. The Sudan type of Ebola outbreak in Uganda is under control, and hopefully next week we are going to be declaring that over. But the message on Ebola is the viruses and the different types of pathogens that cause disease are there somewhere within our environment. It is our role and responsibility to ensure that we follow the right advice so that we do not go and engage with that part of the environment that may expose us to some of these viruses that we thought we already had under control. So as we close the outbreak in Uganda, you and me should work so that we do not have any other happening across the continent of Africa. Second is COVID. We aim for as many of us as possible to be vaccinated. This virus is still there globally, here in Africa as well, and we need to take the right precautions so that if at all it were to visit us, then it does not do so in a way that is going to be very harmful. Vaccination does that protection. So get vaccinated, get boosted if you're eligible, so that we stop the spread of the COVID-19 virus in our population. And the third is Africa CDC. We have engaged for very regularly on this platform and other platforms. And Africa CDC, being a young institution of this continent, needs your support and the support of all our member states and partners, so that as we transition into autonomy, we are able to do that in a way that is beneficial to the continent. And that will only happen if you do your part, share the good work that Africa CDC is doing. If you do your part in providing information to Africa CDC whenever that is necessary, if you do your part in constantly engaging with us so that we are able to safeguard the health of this continent even more effectively. And as we go into that transition of becoming an autonomous institution, we expect that we are going to be able to serve the continent of Africa, including yourselves, even more effectively in the coming weeks, months, and years. I would like to wish all of us a very, very productive 2023, one that is going to be defined by the new public health order. Thank you.
Thank you very much, Ahmed, for a very comprehensive session where you provided that briefing to begin with and then went into the question and answer section. And also thank you very much to all our journalists and other communicators who joined us for the past 50 minutes or so for this briefing. And as the acting director said there, we really wish you the best of 2023. This is the time at which we part for this session. I'm inviting you again to join us next week on Thursday at the same time. Thank you very much. Bye-bye for now.